Hi, my name is Lauren Franklin and this is my video assessment for my Cert 3 and 4-week personal training. I have a client coming this afternoon called Chris and I've texted him the time and location and he's replied and he's all good and he knows where it is and what time to start, which will be in about half an hour. I've checked with the gym owners as well as other personal trainers that are going to be here this afternoon to make sure that they're not going to be using the area that we need to use and also the equipment. So that's fine, they don't need to use it. I've also gone over the equipment that we're going to use to make sure it's safe and nothing's broken or torn or anything like that, and it's all good and ready to go. So yeah, we're just waiting for Chris to get here and then we'll continue. Alright, Chris is here now and I'm just going to go through the pre-exercise screening just to make sure he's all good, no injuries or illnesses or anything like that. Has your doctor ever told you that you have a heart condition or you have ever suffered a stroke?
No.
Do you ever experience unexplained pains in your chest at rest or during physical activity?
No.
Do you ever feel faint or have dizzy spells during physical activity?
No.
Have you had any asthma attacks in the last 12 months?
No.
If you have diabetes type 1 or 2, have you ever had any trouble controlling your blood glucose in the last 3 months?
No.
Do you have any diagnosed muscle, bone or joint problems?
Not that I'm aware of, no.
No. Do you have any other medical conditions that I might need to know about?
No.
Right, perfect. Go quickly. So how old are you?
24.
24, male. Do you have any heart disease history in your family?
No.
No. And how many times a week do you exercise at the moment?
At the moment about 3 to 4 times a week.
Yep. And what's the duration normally when you do it?
Generally about half an hour to an hour.
Perfect. And just your height and your weight as well?
Weight is 70 kilos and I'm about 168 centimetres tall.
Any high blood pressure that you know about at the moment?
Nothing.
High cholesterol or
No.
high blood sugar?
No.
No. Perfect, looking pretty healthy. Have you ever spent time in hospital, including day admission, or for any medical conditions in the last 12 months?
No.
Are you currently taking any prescribed medications?
No.
Are you pregnant? I don't think so. Do you have any muscle, bone or joint pain or soreness that is made worse by particular activities?
No.
Alright, looking pretty good. Alright, so what we're going to do today is we're going to start off by doing a fitness test. We're going to go through some push-ups, probably about 10 to 12, just some bodyweight ones, some chin-ups and then some lunges. And then we're going to go on to some cardio and endurance, and we're just going to do 30 seconds of rowing and 30 seconds of cycling, just watching your technique. And then at the very end, we're going to do a quick workout, a Tabata workout, which is 20 seconds of work and 10 seconds of rest. And you do it 8 times, and we're going to do half squats, just body weight, and half push-ups. Cool. So you do 20 seconds of squats, and you have 10 seconds of rest, and then you do 20 seconds of push-ups and 10 seconds of rest, and you keep going for the full 8 rounds. And that's pretty much it, and then we're going to do some stretching at the very end.
Cool.
All good?
Cool.
Perfect.
Awesome.
Okay, now on to our fitness test. We're going to do a flexibility test. We're going to do a wall squat facing the wall. So I'm just going to demonstrate it now. We're going to put our arms up in the air, and we're going to squat down and back up. We want to make sure we get our full range in the hips. And every time Chris is going to squat, we're going to inch closer and closer until we can get as close to the wall as we can without falling forward or falling backwards. And this is a great hip and shoulder opener, which is in Chris's goals, and we're going to be testing this every 6 weeks. So just see how you go. Perfect. Yep, keep that chest nice and wide. Reckon you can get further? So I'm just going to get Chris to stay there, and I'm just going to measure where his feet were, just approximately about 3 centimetres, so I can see that now. So I'm just going to write that down, and then we'll wait for next time his question. Alright, so now we're going to do a push-up. I'm just going to demonstrate a push-up for Chris first, just so he knows what it looks like, and then we're going to go through the right technique. So first of all, you want your hands shoulder width apart, your legs nice and straight out, you want your core tucked in and tight, and your bum tucked in as well with a nice straight back. And you want your neck also in a neutral position, so you don't want to be going like this or anything like that. You can have like this, your chest up to the floor, and then back up. First we're going to do 10 of these.
Just like this.
Yep, perfect. That's it. Yeah, try and keep your bum down more on your back flat and keep your abs on as well.
Okay.
Perfect. Yep, chest touches the floor. Great. Spot on. Alright, so now we're going to do a chin up with our hands underneath. So what we want to do, Chris, is just jump on the bar with your hands just outside shoulder width apart. Pull yourself up and make sure you use your lats instead of just your arms. You don't want to be having a dead weight hanging up. And keep your core nice and tight and your bum tucked in, and just pull yourself up, and we're going to do 5.
Okay. Just keep pulling until when?
We want to be fully extended at the bottom, our arms fully extended, and
Yep.
chin over the bar at the top.
At the top, okay.
Yep. Perfect. Okay. 2 more. Thanks for that. Alright, now we're going to move on to a lunge. A lunge is a great lower body exercise. So what we want to do is just have a stance about just outside a metre apart. Our back knee should kiss the floor, and our front knee should go over our toes. And our hands can be wherever they like, but preferably on the hips. And this is a great exercise for your glutes and your hammies and your quads as well. And your abs stay on, so they stay nice and tight. What I'm going to get Chris to do is to alternate, so we're going to do 10 on each side like this. And we look straight ahead, we don't want to be looking down or anything like that, because that's when you get a bit wobbly. Alright, sorry.
Okay.
Perfect. That's it. I don't need to correct anything because it's so good. Awesome, thanks Chris. Okay, now onto the cardio and endurance part of our fitness test. We're going to be using the assault bike. The assault bike is a great tool for all over body workout. We're using our upper and lower, we're using our abs, our core stays on nice and tight, and it also promotes good breathing techniques and getting into the habit of breathing in and out at a regular pace and not getting overexerting yourself. So what I'm going to get Chris to do is to do 30 seconds and try just to get as many calories as you can in that 30 seconds. I'm just going to demonstrate now so we know. So you want to hop on, you want to have your feet just so they're just straight, you don't want to be too bent or be able to reach the pedals. What we're going to use our arms and our legs for this. There we go, and I'm just going to get Chris to do it now for me. Okay, so now we're on to the cardio and endurance part of our fitness test. What we're going to do today is be rowing for 30 seconds and trying to get as many calories as we can on the rower. This is a great tool for your whole body. It strengthens your core and obliques and also your lower and your upper body. So I'm just going to demonstrate now, and then I'm going to get Chris to do it. So lock our feet in like that. Please just pull nice and tight so your feet can't move around. We're going to grab the handles and we're going to drive with our legs, and our arms are going to follow through and touch our chest. And on the way back, it's a reverse. So you let your arms go out and then your legs come back. work and 10 seconds of rest, and it's 8 rounds. So you're working for a full 4 minutes, and with that little bit of 10 seconds rest in between. And we're going to alternate between a squat and a push-up. So the first 20 seconds we're going to be doing a squat, 10 seconds rest, and then the second 20 seconds we're going to be doing a push-up, 10 seconds rest, and going backwards and forwards like that. So you're doing 4 rounds essentially of each movement. So a squat is pretty straightforward, like we did previously with the bar. Feet just out shoulder width apart, abs on, bum goes down and back up. We want our knees to travel where our feet are pointing, so we don't want our knees to be coming in. And our push-up is also similar to what we did before. Our hands just outside shoulder width apart. We want our abs nice and tight on, nice neutral neck looking down, maybe just about 3 inches in front of your hands there. We want our chest to touch the ground and back up. Like that. Alright. Just going to do that now. Just give you a countdown. 5, 4, 3, 2, 1. Off we go. That's it. That's it. You're 10 seconds in, so you're halfway. That's it. Tuck that bum in as you come up. That's it. And you're done. You've got 10 seconds rest. Now we're on to our push-ups. 3, 2, 1, go. That's it. Chest touching the floor. Fully extended up at the top. We're halfway there. That's it. Shake your arms out if you need to. Give them a good shake. That's it. You've got 4 seconds. You can do 2 more. That's it, and you're done. 10 seconds rest. And we're back onto our squats. 3, 2, 1, and off we go. That's it. Pick a nice good pace and then just stick with that. Remember, you are doing quite a few rounds, so you don't want to tire yourself out too quickly. Halfway through, you've got 10 seconds left. That's it, perfect form. Good job. 3, 2, 1, and rest. Back onto our push-ups. 5, 4, 3, 2, 1, and away we go. That's it. Making sure your legs don't touch the floor, just your chest. That's it. Shake your arms out if you need to. You're more than halfway there now. You've got 6 seconds left. 3, 2, 1, and rest. Good job.
Is that 2 rounds?
Yep.
2 more.
Yep. Make it look easy. 3, 2, 1, and go. That's it. Halfway through. Making sure you're reaching full range at the bottom. That's it. And straight back up. 2, 1, and rest. Back onto our push-ups. 3, 2, 1, and away we go. That's it. Perfect form. So shake your hands out if you need to. You're halfway there. Let's see if you can get a few more in. That's it. 3, 2, 1. Good job.
This is the last round?
Yep.
Cool.
So you got one of each. 3, 2, 1. Off we go. That's it. If you have a number in your head, just stick with that. Just remember, this is the last bit of squats that you're going to have to do for the day, hopefully. That's it. You've got 5 seconds left. 3, 2, 1. That's it. And this is our last bit of your push-ups for today. You've got 5 seconds left of rest. 3, 2, 1. Off we go. So try and give this last bit your all, because this is all you're going to have to do, and then we're just going to do some stretching. That's it. Halfway there, you've got 10 seconds. Try and keep going. That's it. 3, 2,
1, and you're done. Good job.
Okay, now I'm just going to talk quickly about special population. The first one we've got is high blood pressure. So high blood pressure is anything over 140 over 90, and the normal range is 120 over 80 to 140 over 90. When it comes to training someone that has high blood pressure, I want them to have a doctor's clearance before I train them, just to make sure they're good to train. When it comes to doing a workout, I'll just watch how they go. I won't give them something too hard and too strenuous just to start off, and then you know how your client is feeling, and then you can go from there. When it comes to a class environment, they still can do the class workout, especially CrossFit classes, because they're easily scalable, and you will just have to test the waters and see how they feel on the day. But essentially, you would want, if someone has high blood pressure over 140 over 90, they would need to have a doctor's clearance before I train them. When it comes to someone with lower back pain, I would need to know the severity of their back pain. If it's quite severe, obviously you want a doctor's clearance. You would refer them to their GP, a physio, chiro, remedial massage therapist, someone like that. When it comes to training someone that has lower back pain, you obviously want to avoid the pained area, which is the back. It's quite restricted when it comes to things like that, so I would recommend for that person to have rest. I wouldn't want to be training them if they've got a lower back pain. Depending on the severity, but in general cases, you need them to heal properly until they're 100%, and then they can fully commit to the training again. When it comes to a shoulder or knee injury, same principles apply. It depends on the severity of the injury. You would want a doctor's clearance before you train the person in case you make the injury worse, which is not beneficial for you as a trainer or the client. And then you would work around their injury. So if they had a knee injury, you might focus more on the upper body or just a restricted range of movement within the knee. And when it comes to shoulder injury, same conditions apply. So they might not be able to do anything overhead, but they might be able to squat. But same principles apply as the lower back pain. You would want them to have a doctor's clearance, and then if they didn't, you would refer them on to someone. Alright, so now we're just going to finish off with some stretches. We're just going to do 30 seconds of each side of a quad stretch and just a gentle arm stretch through the lats and the triceps as well. Alright, so we'll just do this one. You lift your leg up like this and hold it with your same hand on the same side.
Yep.
Yep, and we're just going to do 30 seconds. If you need to hold anything, you can hold back. Go on, box if you need to. It's alright, you've still got 20 seconds.
From
3, 2, 1. I'm just going to change to the side. Yeah, same hand, same foot. Yeah. And you should feel the stretch just through here.
Yeah.
So if you're not, it might be too far forward or too far back, or the leg might be too far out, so you've really got to push the arm forward. Ten seconds left. Three, two, one. Perfect. And now we're just going to do, you can move back onto your other arm.
Yeah.
We're just going to do a little gentle stretch like this. So you should have your arm straight back down, back, and just gently pull the elbow with the other hand. And you should feel it just down here, and also here as well.
Oh yeah, I feel that.
Take 10 more seconds left. Three, two, one, and now we're just going to go up to the other side. So same thing, arm straight down your back, and then a gentle pull with your hand on your elbow. Twenty seconds left. 10. 3, 2, 1. Thanks very much, Chris. I hope you enjoyed it and that you're back and you weren't in too much pain.